stands in the operating room and we just tell it what to do, and it walks over to the patient and does the surgery and walks away and has coffee. That's, of course, not the case. The robotic arms look very much like the arms that you see when you look at videos of auto manufacturers. You see the arms come down and they weld up the thing and they do this and that. Well, this is really very much the same thing. The robot patient cart is just the arms of the robot, and the arms won't do anything unless the surgeon at the console makes the robot arms do it.
It includes a video screen where you can see all in detail what you are operating on. Your assistant can see this video screen. Then there's a patient cart with robotic arms, and the surgeon actually places laparoscopic trocars into the patient, pretty similar to our laparoscopic surgery, and then actually has robotic arms attached to those trocars.
Then there's the surgeon's console, which is separate from the patient, and that's where the robotic surgeon sits to manipulate the instruments. And so the surgeon's console has a visor where the surgeon puts their face in so they can get binocular vision. And then there are instruments at the bottom, and the robot will then mimic the surgeon's hand motion inside the patient.
The robotic arms are literally just an extension of the surgeon's arms. If I move my hand like this in the machine, the robotic arm will do that. If I twist my hand, the robotic arm will do that. If I grab something, it'll grab.
And that will allow the surgeon to tie knots, throw needles, dissect, and it will basically reproduce those maneuvers inside the patient.
So it's an amazing way to actually see and operate with the robot assisting you.
The robotic arms are engineered to do things that human hands cannot do. For instance, the robotic arms have a range of motion that the human hand does not have. My hand only goes this far, this way, and this way. With a robotic instrument, we could literally make it go 360 degrees. So it gives us a degree of range of motion which gives us greater flexibility and gives us more opportunities to do more sophisticated, delicate work in the operating room.
About 64% of patients were having open, not just laparoscopic, open surgery, big incision, in 2005. And the Da Vinci can actually allow you to change that because of the fact that you don't have these limitations anymore of seeing what you're doing and operating safely.
So for the patient, the advantages of robotic surgery include shorter hospital stay, less blood loss, fewer short-term and long-term complications with either equivalent or possibly better either cancer outcomes or surgical outcomes in general.
So they afterwards have minimal pain, minimal narcotic use, are back to work within 2 weeks if they want to be back to work.
At the end of an 8-hour day in the operating room, we all kind of walk out of the OR with creaky backs and, you know, grumpy and stuff. The robot is nice in that we can sit down at the console comfortably, and it's not as hard on our bodies.
So robotic surgery takes a long time to learn. It's a newer technology. It's been around about 10 years.
The training was complicated. It was a commitment, basically. The first thing is you make a commitment that you're going to learn this technology because it is different than traditional laparoscopy.
It's not something you just read a book about one night and go in and do the next day. It's a very complicated instrument.
I was very lucky to be in a training program that adopted technology very early. And I did my medical school and then internship where we would do things the traditional way and the laparoscopic way, and then the robot came on.
You should be doing at least a couple hours of simulation each week before you actually start operating.
Just like a flight simulator is required for a pilot, right?
It's like a human video game, a very, very particular type of video game.
And as a resident, I was able to observe and then assist and then do robotic surgery over those 6 years.
It probably takes, on average, the average robotic surgeon really a couple of years before they feel like they're doing a good job for their patients.
Well, the application of the robot has evolved. Initially, urologists started first and mostly doing radical prostatectomies for prostate cancer. and then moving on more to kidney cancer. Eventually gynecology started doing surgeries as well, and now they're trying to expand into general surgery, gallbladders, colons, things like that. There are also cardiac surgeons using it, so it's slowly expanding.
The ability to bring this technology to my patients is an amazing feeling. It feels like I'm in the next generation. I can see what I'm doing. I can feel like I can offer way more to my patients, and to see them afterwards doing so well is very gratifying. It's worth all of the trouble of learning how to do it.
Our next